Welcome to SISEP Stories. The stories and scenarios in this series highlight individuals using competencies from the Implementation Practitioner Practice Profile. In this video on brokering, we will focus on the following Implementation Practitioner competencies. Brokering. Let's return to Julie's story, our public health specialist. Julie is overseeing the implementation of a county-wide school mental health initiative that needs to span all 7 school districts in Implemania County. Last we saw Julie, she had successfully used her skills in co-creation and engagement to build a community team and conduct a county-wide needs assessment. She then used strategies such as the nominal group process to identify goals for the school mental health initiative. But developing and managing an implementation plan require an entirely different set of skills and strategies. Brokering is a critical competency for implementation support practitioners like Julie. Effective brokering facilitates implementation in several ways: building and maintaining effective relationships, navigating complex social and political contexts, promoting collaboration and knowledge sharing. Julie accomplished these goals through several strategies that fall under the category of brokering. She established mutually beneficial relationships. She installed and used communication protocols. And she collected data. But more than just collecting data, she shared and used data. As one way of establishing mutually beneficial relationships, Julie helped the community team conduct a resource assessment that identified people, organizations, and other assets related to school mental health across the county, including individuals and agencies that could provide mental health services and supports in the 7 school districts. Having identified these individuals and organizations, Julie convened them into an implementation work group. The implementation work group included representatives of the 7 school districts, as well as funders, family and youth leaders, and others. Importantly, the work group also included representatives of the mental health agencies identified by the resource assessment. Historically, these providers had been engaged by the county's schools and districts in an uncoordinated and piecemeal manner. But bringing these stakeholders together helped these partners to understand the others' needs and strengths, and how they could all benefit from working together to meet the goals for the initiative. The second strategy for effective brokering is to establish communication protocols. Julie made sure each group had a communication protocol in place. These protocols specified how often each group would meet, how often each would report to the other groups, and what kind of information would be shared. The communication protocols also stated that meeting agendas and reports must relate to the overarching goals for the initiative, use school mental health strategies across all 3 tiers, use proven effective practices, establish and resource a county-wide structure for school mental health. This leads us to a third strategy for effective brokering: sharing and using data. To assure decisions were informed by reliable and valid data, the implementation work group created a subgroup called the Evaluation and Data Team. This team's job is to do the hard work of compiling data to meet the information needs of the implementation work group and the community team. Julie knew that using data effectively would require clearly defining the initiative's information needs. This is a critical step for the evaluation and data team before it decided on data sources and measures. To identify its information needs, the community team again referred back to the originally defined goals for the school mental health initiative. For example, to evaluate the goal of providing support across all 3 tiers of school mental health, the evaluation team developed a monthly survey of all the newly funded school mental health providers. The survey asked providers to report the types of activities they engaged in across Tier 1 school-wide supports, Tier 2 early intervention, and Tier 3 intensive or individualized services. To evaluate the goal of using proven practices, the evaluation team surveyed each school's principal and other building leaders on how well the providers were adhering to the multi-tiered systems of supports framework. For example, one section of the survey asked school leaders to report how well the providers were integrated into their school's teams and day-to-day routines. These and other measures were all incorporated into an evaluation plan for Implemania County School Mental Health Initiative. The plan didn't just describe the measures and analysis, but to whom, when, and in what format the information would be provided. As we will learn in the next part of our SISEP story, this evaluation plan, and the information it produced, provided critical data that informed major adjustments to Implemania's countywide school mental health plan. Julie's work to lead the Implemania School Mental Health Initiative required using several strategies related to brokering. Importantly, Julie's experience as an implementation support practitioner led her to know that brokering is not something that is improvised or done on the fly. Brokering requires specific strategies. Julie organized people thoughtfully into groups, set rules around communication, and collected and used data related to the goals of the initiative. By using these brokering strategies, Julie promoted effective relationships, collaboration, and decision-making, all critical elements of a successful implementation effort. Thank you for viewing this video. For more information on practitioner competencies, please head to the Active Implementation Hub and click the Implementation Support Practitioner Competencies tab. For more information on implementation science, check out the Active Implementation Hub.